Hello and welcome to another video. If you are somebody new here and you are a medical student or you just want to find out about rheumatoid arthritis, signs and symptoms, then you are at the right place. Now in today's videos, we're going to discuss the signs and the symptoms of rheumatoid arthritis. As for the medical students or doctors who are preparing for licensing exams such as PLAB&MEDICINE, I have included a question which is from the 1700 questions for the PLAB&MEDICINE bank as well. So this video is going to be divided into two parts. First of all, we're going to have a review of rheumatoid arthritis, signs and symptoms, and then we are going to discuss the 1700 question for the PLAB&MEDICINE. So let's start. All right. So the first thing you have to remember about rheumatoid arthritis is that it is an inflammatory condition, which means the basic problem that's going on with the joints is inflammation or swelling of the joints. So you will see all the signs or symptoms that are involved with inflammation, such as redness, there is swelling, there is pain, there is stiffness. So these are the symptoms, but we will be going through the symptoms later on as well. However, for now, just remember that the main problem is inflammation that's going on with the joints. Also, you have to remember that it is a long-term or a chronic condition. However, having said that, there are points where the condition can be well controlled, or at other times where the patient might experience flare-up when there is increase in the symptoms such as in pain and in swelling as well. Another important thing to remember about arthritis is that it is symmetrical arthritis, which means that it affects both sides of the body usually. So if you have a problem with the right knee, you'll most probably be having a problem with the left knee as well. So it is what is called symmetrical arthritis. So it affects the body symmetrically. All right. I will also be telling you some of the high yield points for the PLAB&MEDICINE exam or for other medical exams if you're a medical student. So just bear with me. I will be highlighting some of the high yield points that you must remember for the medical exams. All right, as we go along. All right, a very important point, a very high yield point that you have to remember is that rheumatoid arthritis, basically the common joints that are affected are the small joints versus the big joints. So it mainly affects the small joints of the hand and feet. So the patients usually complain of pain in the hand or in the feet. All right. So the small joints, this is a very high yield point that you have to remember for the medical exams. Also, another important point that you must remember is that the patients usually tell you that the symptoms are probably worse in the morning. So the first thing in the morning, the pain or the stiffness is really bad. Okay, and as the day goes along by, it gets better. Why it's important, why it's a high yield point for medical exams, is that it helps us to differentiate rheumatoid arthritis from another type of arthritis, which also affects the joint, what's called osteoarthritis, because the opposite happens in osteoarthritis. All right, in osteoarthritis, the pain and the stiffness actually is worse by the end of the day. So you have to remember that because it really helps to differentiate between these two kinds of arthritis. So it is a very high yield point that you have to remember. All right, now let's look at the symptoms. We did briefly discuss some of the symptoms before, but let's go in a little bit of detail. What are the symptoms that are experienced by the patient? First of all, swelling. So the joint is really swollen. All right. The other one is pain. Now, this is something very important to remember in terms of medical exams, or as well is the fact that the pain is usually worse first thing in the morning in rheumatoid arthritis. All right, so after a long period of inactivity, or maybe let's say once you've woken up early in the morning, like after a nap or something as well, the pain will usually be worse. This is a very important point to remember for the exam, especially the PLAB exam. All right, another symptom that's experienced by the patients is stiffness in joints. Of course, we're talking about mainly about the small joints of the hand and feet. So this is worse in the morning as well. So both pain and stiffness are usually worse in the morning or after periods of inactivity. And that's a very high yield point to remember for the exams, for the medical exams or for the PLAB exam. All right. While we do know that this condition, rheumatoid arthritis, mainly affects the joints and usually the small joints, it rarely presents as a systemic disease, which means that sometimes the patient might experience more generalized symptoms such as fever or weight loss or other kind of symptoms as well, but it is one of the rare presentations. All right. So these were the symptoms of rheumatoid arthritis. Now I'm going to talk about the signs of rheumatoid arthritis. So what are the findings when we examine the patient hands or feet? All right, the joint that is affected by rheumatoid arthritis, what are the kind of, and I will be showing you pictures as well, okay? All right, so we can divide the signs of rheumatoid arthritis into early or late, okay? Where the disease has just started or is in its early stages, the main sign of the main problem that we will see is usually inflammation. So there will be no deformity of the joint in the early stages of the disease. And the swelling of the joints is the main problem, as we have discussed, and we will see swelling of the small joints of the hand, such as metacarpal joint, proximal interphalangeal joints, and the wrist joint as well. So these are, if you're not a medical student and you're just looking at this presentation, then these are just the names of some of these small joints that are present in the hand. All right. Okay. Whereas that was the early signs of rheumatoid arthritis, now we compare it to the late. So when the disease has progressed to a certain stage, then we can also see some joint damage and some kind of deformity in the joint as well. We will be looking at pictures later on to see what are the kind of signs that are present. All right, so please don't worry about that. Now, we are going to talk about the signs of rheumatoid. What are the examination findings when we examine the hands of the patient? So if you're a medical student, then you probably might guess what it is. Any ideas? Please leave it down in the comments below if you can tell me what particular sign of rheumatoid arthritis is being shown in this picture. All right, so do comment below if you can get it right. And if you can, then well done. All right, okay. So what is it? Well, this is one of the very high yield points for the exams, for the medical exams and for the PLAB exam. So this one, what the picture shows on the right-hand side is basically the ulnar deviation. It's one of the signs that is seen on the examination when we examine the hands, is ulnar deviation. So if you can see here on the picture, the fingers, if you can see, they're not really straight and they're bent towards the little finger. So this is the little finger. This is the ulnar side of the hand. That's what we call in medical terms. And you can see that instead of the fingers being straight, as normally they should be, however, in this picture, they're actually bent towards the ulnar side or towards the little finger. And this sign of rheumatoid arthritis is called ulnar deviation. That's shown beautifully in one of the pictures. Okay. All right, so that was one of the signs. Okay, let's see some more things. All right, now this next one. Any idea what sign of rheumatoid arthritis is being shown in this picture? If you can, just comment down in the section, just comment down below if you can tell me what's wrong with this picture, or like what kind of particular sign of rheumatoid arthritis is being shown here. Any idea? If you can look at the fingers especially, that's a clue. All right, I hope you have figured it out. Okay, this is what we call as swan neck deformity. That's it's another important sign of rheumatoid arthritis. And if you can look at the fingers, basically, especially this finger that's quite prominent here, you can see the swan neck deformity here. All right. And what happens in this one is that if you can see, this is the distal interphalangeal joint. So the joint that is furthest away from the body is the distal one. All right. And here you can see that it's kind of bent. Can you see this bent here? Okay. So the distal interphalangeal joint is actually, it's flexed, it's bent. Okay. Whereas the PIP, or the proximal interphalangeal joint, is hyperextended. So you have to remember this thing for the exams. This is a very high yield thing for the exams. So there is DIP flexion versus there is PIP hyperextension. All right. Okay. And this is how it looks, this swan neck deformity. This is another sign of rheumatoid arthritis. All right. The next one is already written here, okay, but it is Butternuts deformity. All right. And what happens in this? This is basically, you can remember it the way I remember, it's basically kind of opposite of the previous one. All right. So here, what we see, if you can look at the picture here, if you especially look at the fingers here, you can see that this, what joint it is? It is the proximal interphalangeal joint, okay? This one, because it's closer to the body, so it's the proximal one. So proximal interphalangeal joint is here, and you can see that it's kind of bent. The fingers, she can't straighten her fingers, okay? And the fingers are kind of bent, like in a claw kind of thing, okay? So you can see that the fingers are bent, so it is PIP flexion. However, the distal joints are basically hyperextended as well. So it's kind of opposite of the previous sign, if you want to remember it like that. And it's also a very high yield thing to remember for the medical exams or for the PLAB or UKMLA exams. All right, and this was just a reference where I took this picture from. I hope it's a clear one. All right, and other signs that you have to remember for this one is basically Z deformity of the thumb. All right, if you can look at the thumb basically here in this picture where I'm moving my cursor, you can see the shape of the thumb. Okay, and this is what's called, like, it's called Z deformity of the thumb on examination. So it's another important sign that of rheumatoid arthritis that the patients experience. Okay, so this was this one. All right, now the second part of the lecture is basically I'm going to discuss the PLAB1 preparation question, and I've taken this question from the 1700 questions that are like basic, very crucial if you want to prepare for the PLAB1 or the UKMLA exam. That's what's going to be called in the future very soon when the PLAB exam is changing a little bit. All right. Okay, I will link up this news. I will link up the other video for this one. All right, so let's look at the question. The question is, a 32-year-old patient comes in complaining of early morning stiffness and pain in the small joints of her hands. Okay. She has also noticed that her eyes to be red and painful at times. What is the most likely diagnosis? So let's look at the options. Rheumatoid arthritis? Is it osteoarthritis? What is the most likely diagnosis? Is it juvenile rheumatoid arthritis? Or is it SLE? Okay. Now, there are some key points that you want to remember in this question. If you look at the age of the patient, okay, she's fairly a young patient, okay, and she's complaining of early morning stiffness and pain, okay. So early morning is something really important that you have to remember, because remember when we were discussing the signs and symptoms of rheumatoid arthritis just earlier on, I did mention that it's the first thing in the morning, okay? So when you just get out of the bed or after periods of inactivity. So early morning stiffness and pain is a clue, all right, that you have to remember. And then the kind of joints that are affected are the small joints of the hands, all right? That's another clue that you have to remember, okay? So small joints of her hands. Okay, that's another clue. All right, she has also noticed her eyes to be red and painful at times. Why is that? Because there sometimes rheumatoid arthritis can actually present with other extra articular manifestations or symptoms. So it can affect other organs of the body, like other places apart from the joints as well. And it is scleritis or episcleritis sometimes, which is associated with rheumatoid arthritis. Okay, so that's another clue, because there is another associated disease present. All right, and apart from that, morning stiffness and pain, and the type of joints that are affected is another clue, small joints of the hands, all right, and the associated condition that's given as well by telling us that the eyes are affected as well, all right, and she's a fairly young patient, all right. So all these clues, 3-4 clues, actually tell us about that the correct diagnosis, the most likely diagnosis in this case is rheumatoid arthritis. Now let's look at the other options which are not correct. very quickly why it's not osteoarthritis. Let me tell you some differentiating points. In osteoarthritis, the patient is usually an elderly patient, all right? Okay. And instead of having morning stiffness, they will usually complain of pain and stiffness at the end of the day, okay, by evening time. All right. That's when their pain and stiffness really gets really bad. Okay. So, but here we can see it's early morning, so it's not osteoarthritis. Okay. Then juvenile rheumatoid arthritis, it usually affects children under the age of 18. So it's usually like the age it probably will be some child, like, So here we have a young patient, so it's not that. Okay, SLE, why it's not SLE? Because in that one, you will have, well, SLE can affect joint, first of all, yes. So it is possible. However, why it's not the case in this scenario is because we will have some additional symptoms in the vignette in the question, which are very main features. For example, they might tell us of a malar rash, which is present on the bridge of the nose or on cheeks. All right. So they might tell us that. They might give us some other symptoms like photosensitivity, which is very common in SLE as well. So the classic rash and the photosensitivity and other symptoms will be given if arthritis was presenting as one of the problems of SLE. However, that's not the diagnosis, okay? We are not given anything. This patient is not experiencing anything like that. So it's definitely not SLE. It's more probably it's rheumatoid arthritis, okay? So that was the 1700 question. All right. Okay. So thank you so much for watching. If you are new here, please, before you go away, just kindly subscribe to my channel. I do make videos regarding medical topics. If you want to know about medical conditions, if you are preparing for your PLAB exam or for other licensing exams, please consider subscribing to my channel. But it just gives me motivation to make more videos like these. All right. And please press the bell icon as well, because otherwise you won't be notified of my next video. All right. And I hope you found it useful. If you found it useful, please share this video with other people who are preparing for the PLAB exam or other medical students. And if you've got any questions, please leave it down in the comment section below. I will try to answer any questions that you have. And please do consider subscribing. All right. So thank you so much for watching, and I'll see you in the next video.